Good evening, everyone. Today's topic is on sampling. Although this topic appears much later in the list of the webinars, I would like you to give a gist of what is sampling so that it enables you to understand the coming topics like study designs, qualitative and quantitative designs. Now, to start off this webinar, I would like to place a scenario in front of you. Now, you decide upon a research question, you also decide on whom you should conduct the study. You want participants for your study? Let's take an example for time being. You have developed a wonderful exercise program on management of osteoarthritis and that you are so thrilled with it that you believe this exercise program is going to solve the misery of patients and prevent them from going for knee replacements. Although that's not quite possible unless you catch OA early, nevertheless, let's assume this example. So you continue with this exercise program and you want this exercise program to work for all the osteoarthritis patients across the country. This means that you are going to generalize your exercise program on all osteoarthritis patients. But first you have to test it. On whom you will do it? From where you will get your participants? You think in order to find the efficacy, it's better to try on all the people who have osteoarthritis in India. But that's not possible. The population of OA is so huge for your study that you might want to ditch your study. This large group on which you want to find the efficacy of your program is called as population. So finally, you give up the idea of studying the whole osteoarthritis population until somebody like me informs you that the study still can be done on small group of osteoarthritis and that you can generalize the effects to the whole population of OA throughout India. Now you feel good. So this small number of participants on whom you would study the efficacy would be called as sample. The efficacy you came to know from your study on this small group of participants or sample is so overwhelming that you would like to generalize your findings on the whole population of osteoarthritis. So in short, this is the overall purpose of choosing a sample, that is generalization to a larger group. For time being, we can leave other questions apart. Now, let's take the example of osteoarthritis, which was taken in the previous slide. Now that we have chosen a smaller group, which is known as sample, now we will use this result obtained from the sample after analysis of the sample to generalize it to the bigger population. Now the question arises that is this the sample good enough so as to generalize the finding to a bigger population? We would be addressing this question later, but for right now, we should be choosing the correct sample, which should meet the minimum requirements applicable for research question. How drawing conclusions from this smaller sample to the bigger population generalizable? Now we use a technique known as sampling. The three main uses of selecting a sample are: one, selecting a sample is time consuming, then selecting every item in the population. Selecting a sample is less costly than selecting every item in the population, and analyzing a sample is less cumbersome and more practical than analyzing the entire population. Before you begin sampling, you need to define your population. From a list of potential respondents, and this list is known as sampling frame. It can be patient records, it can be class rosters, or it can be voting list. Now in this slide we will discuss the ideal sampling process or the stages involved in the process of sampling. We first define the population of concern. We specify a sampling frame and set of events or events possible to measure. We will specify a sampling method for selecting the items or events from the frame. Then we determine the sample size. We implement the sampling plan. We collect the data and we review again the sampling process. For example, you might want to study interventions in osteoarthritis knee. You may choose a frame where the target population to be studied will have osteoarthritis with Kellgren-Lawrence grading of 3. Now we know that exercise therapy can alleviate most of the suffering from KL1 or 2 grades. Again, if you include BMI, then BMI will further restrict your frame. The methodology depicted here is to check whether your sampling process is appropriate or not. We are not going to discuss about it right now, but we are definitely interested in types of sampling, their advantages and disadvantages. What makes a sample? Now below are given the examples which will tell you what is a sample. Now first example can be when you are studying quality control in an industry, the samples can be entire inventory or a particular manufacturing lot. It can also involve surveys from different households or population of housing units. Population can include people, places, organization, objectives, animals, days, or any other unit of interest. Now, all these are examples of what can constitute a sample. The factors which can influence the representativeness are the sampling procedure, the sample size, the responses which you have got from the samples. Now, when we consider entire population, we should know what is the size of the population. Is it very small? Whether we have extensive resources to cover that population, or we should know how much response we are going to get from that particular population, and that will help us in deciding sample size. Now, when we talk about clinical research, we usually consider human population. In some studies, we may consider animal population, but human populations by nature are heterogeneous, and variations that exist can be in behavior, psychology, or physical attributes. But we should not run into the risk of homogenizing our sample, otherwise, it may not represent the whole population. Now, in order to make generalizations to a larger population, we need to include normal data. Now, when we choose a sample through sampling method, we usually run into the risk of having a bias while selecting the cases for the study. Now, we are tempted to select only those individuals in the previous example, like osteoarthritis, who are likely to get better or who would show less severe symptoms. And that's where we are biased. And this bias doesn't help in our study except to finish our thesis or to get the degree and get into the practice. Now, there are two types of biases. One is the conscious bias and the other one is unconscious bias. Now we take example of conscious bias. Suppose there is a clinician who takes only those patients with minimal dysfunction so that he can demonstrate the treatment's effectiveness. And in this way, he is eliminating those subjects who are not likely to improve. So that's a conscious bias. Unconscious bias occurs when the person is not knowing where he is collecting data. For example, if we take an interviewer who is interested in knowing the public's attitude towards disability, and he collects the data while standing on the busy street, and there are a lot of tourists, probably the people are not interested in his interviews and they are just marking or giving response haphazardly. This is unconscious bias. Now, another example of unconscious bias can be that the interviewer is unconsciously choosing to approach only those people who look cooperative on the basis of appearance of gender or some other characteristics. People who do not work or shop in that area will not be represented. The conclusions drawn from such a sample cannot be useful for describing attributes of general public. Or probably there are a lot of tourists, so they do not represent the population of that particular area. And that's where their interview responses will bias the whole study. Now, who qualifies to be the subject? That's what we term as inclusion criteria. The researcher must consider the variety of characteristics present in the population in terms of clinical findings, demographics, or geographic factors. They should also depend on the type of question being studied. It is also important to remember how the researcher restricts the population. Now, exclusion criteria indicate those factors that precludes someone from being a subject. The factors will generally be considered potentially confounding to the results, that is, they are likely to interfere with the interpretation of the findings. For example, if you take the example of osteoarthritis, and when you take osteoarthritis of KL grade 1 and 2, but when you consider BMI, the inclusion of BMI will confound the efficacy of the program. Now, when we acquire samples for the study, we need to utilize the same process throughout the study. Sampling techniques need to remain same across the study period too. Types of sampling techniques include probability sampling and non-probability sampling. Now, probability sampling also means random sampling. Random doesn't mean haphazard, it just means that all samples in the population are having equal chance of being selected. While non-probability sampling depends on the convenience or the purpose for the sampling. They can also form a part of convenience sampling or purposive sampling. Simple random sampling is the purest form of probability sampling, where each member of the population has an equal and known chance of being selected. And this is done by assigning a number to each unit in the sampling frame. When there are very large populations, it is often difficult to identify every member of the population, so the pool of available subjects become biased. After we have made the list of samples, in order to pick up random samples, we can use random number generation or you can use random tables. The other form of probability sampling is known as systematic sampling. It is often used instead of random sampling. After the required sample size has been calculated, we calculate nth record from the list of population numbers. The list should not contain any hidden order, and this sampling is good as random sampling method. The only advantage of systematic sampling over random sampling is its simplicity. Here the researcher divides the total number of elements in accessible population. For example, if we need to select 100 people from a list of 1000 students, every 10th person on the list is selected. Therefore, the interval selected between the elements is called sampling interval, and in this case it is 10. Now, another type of probability sampling is known as stratified sampling. This sampling method is commonly used and is superior to random sampling since it reduces the sampling error. Here we identify relevant strata of the sample and find out the actual representation in the population. Now here we perform random sampling in each strata to include sufficient number of subjects. Now this kind of sampling takes additional time, but it provides more representative sample. Stratification increases the precision of estimates only when the stratification variable is closely related to the variables of experimental interest. It would not be of any interest to stratify subjects on the basis of blood type. For example, in study of attitudes towards elderly, it might be important to use variables such as age, gender, or race. When we are studying osteoarthritis, we usually classify people in different age groups. People who get osteoarthritis between 40 to 45 years have different clinical characteristics and muscle atrophies than compared with people who fall from age group between 50 to 55 years. Therefore, it would be unethical to place them in a single group or strata. Another reason why stratified sampling is often used is when one or more of the stratums in the population have low incidence relative to other stratums. For example, if we consider the age group of 40 to 45 years, they are considerably less in numbers than people who are having osteoarthritis in the age group of 50 to 55 years. Now, national samples for surveys and polls are often stratified by geographic area, so the distribution of regional variable mirrors the population. Now, here at this stage, it is appropriate to introduce disproportionate sampling. Imagine that there are 2,000 therapists, and out of which 1,700 are females and 300 are males. And now we want to draw 200 therapists, so we decide to take 10% of each group. This would not allow males to be adequately represented. But if we take 100 males and 100 females, then the males will become overrepresented. So we need to give appropriate weightage to the individuals who are underrepresented. Therefore, we will calculate proportional weights. We'll determine the probability of any one female or male being selected. For example, in order to choose 100 females, the probability of one female being chosen is 100 out of 1700 or 1 by 17. The probability of any one male being chosen is 100 out of 300, that is 1 by 3. Therefore, each male has probability of selection more than 5 times that of any female. Then we determine the assigned weights by taking the inverse of these probabilities. That is, the weight for female scores is 17 and for male is 3. When the data is analyzed, each female score will be multiplied by 17 and male score will be multiplied by 3. And that's how we give weightage in disproportionate sampling. Now, cluster sampling, it's a probability sampling in which each sampling unit is a collection of geographical area. These type of sampling are effective under the following conditions. When a good sampling frame is not available or it is very costly to list the sampling frame, or the cost of obtaining observation increases as the distance separating the elements or the sampling frame increases. Now, the examples of clusters are city blocks, political or geographical, housing units, hospitals, or automobiles. Cluster sampling is also known as two-stage sampling, in which the first stage we decide the area, the second stage we decide sample of respondents within those areas. Now the population is divided into clusters of homogeneous units, usually based on geographical contiguity. Then the sampling units are grouped rather than individuals. A sample of such clusters is then selected and all units from selected clusters are studied. The advantages of cluster sampling are that it cuts down on the cost of preparing a sampling frame. It reduces the travel time and administrative costs. The disadvantage of cluster sampling is that the sampling error may be high than the simple random sample of the same size. Now we will discuss about non-probability sampling. Um, a sampling method is considered to be non-probability sampling when the members are selected from the population in some non-random manner. The elements of the population have no chance of selection, where the probability of selection is not accurately determined. Selection of element is based on assumptions regarding the population of interest, and sampling errors cannot be calculated. Convenience sampling is the most common form of non-probability sampling. Here the samples are chosen on the basis of availability, and the consecutive sampling is also a problem when the study duration is short. Quota sampling is a kind of stratified non-random sampling. Purposeless sampling is a kind of sampling method where a researcher handpicks the subjects according to the study requirement. Now, a fair judgment by a researcher should be exercised when the participants are being selected. The researcher may wish to see the effectiveness of an exercise program from individuals coming to the clinic, and he chooses the responses of only those patients who are compliant with the exercise program. And then it becomes a biased sampling. This kind of sampling is common in qualitative studies where the researcher wants to make a note of barriers associated with that kind of exercise program. Another kind of non-probability sampling is called as snowball sampling. It is also known as word of mouth approach. And this kind of technique is used to study rare topics, sensitive topics, and usually the studies are completed in personal networks or social networks. Again, in snowball sampling, the person usually informs one of the study subject, and in the second stage, this study subject, by the word of mouth, spreads the word about recruitment of the participants. These kind of sampling methods are used in studies of drug addicts or study of antenatal programs. So this marks the ending of webinar, which is on sampling techniques, understanding sampling techniques, and the types of sampling methods.